How do I know if I'm pregnant? What are common symptoms of pregnancy? Everyone experiences different symptoms of pregnancy and at different times. It's important not to compare your pregnancy to someone else's because pregnancy symptoms can vary so dramatically. The most common symptoms include a missed period. The most common and obvious sign of pregnancy is a missed period. Once conception has happened, your body produces hormones that stop ovulation and the shedding of the lining of your uterus. This means that your menstrual cycle has stopped and you won't have a period again until after your baby is born. Frequent trips to the bathroom. Before you even miss a period, you may notice that you have to pee more often. During pregnancy, your body's blood supply increases. The more blood in your body, the more you'll have to pee. Fatigue, feeling tired. Many people feel extremely tired in early pregnancy. This sign of pregnancy happens because of high levels of the hormone progesterone. Morning and noon and night sickness. Despite the name, this pregnancy symptom can happen at any time of the day or night. Not everyone experiences nausea, and there are various levels of nausea. You can feel nausea but never vomit. Sore and swollen breasts. Your breasts can become tender to the touch during pregnancy. Your areolas, the area around your nipple, might also begin to darken and enlarge. This soreness is temporary and fades once your body gets used to the increased hormones. What are some less common signs of early pregnancy? Less common signs of early pregnancy can include spotting, also called implantation bleeding. Though it may seem like a bad sign, light bleeding, spotting, can be a sign that an embryo has implanted in the lining of your uterus. Implantation bleeding looks like small drops of blood or a brownish discharge from your vagina. Spotting can cause some people to think they have just had a light period and aren't pregnant. Food cravings, constant hunger, and food aversions. Food can be complicated during early pregnancy. Some people begin to crave certain foods or feel constantly hungry. While some foods and flavors may seem wonderful in early pregnancy, others might suddenly taste unpleasant. Metallic taste in your mouth. Many people say that they experience a metallic taste in their mouths during the early stages of pregnancy. It may taste like you have a pile of coins in your mouth. Headaches and dizziness. Headaches and the feelings of lightheadedness and dizziness are common during early pregnancy. Cramping. You can also experience mild period-like cramps that come and go over a few days. Mood swings. As your hormones continue to change, you could experience mood swings. Congestion. Some people experience a stuffy nose in early pregnancy due to the increase in hormone levels in blood. Bloating. While it may take several weeks or months to have a noticeable baby bump, the surge of hormones can cause your stomach to feel bloated and lead to passing gas more than usual. How early do pregnancy symptoms start? It varies. Some people feel pregnant within a few days of conception, while other people don't feel pregnant for weeks after a positive pregnancy test. Pregnancy symptoms vary between people and even between pregnancies. Some people say they felt pregnancy symptoms within a week of conception, about 1 week before a missed period. The best way to know you're pregnant is to take a pregnancy test. How soon can I take a pregnancy test? You can take a pregnancy test as soon as you've missed your period. However, it's best to wait at least 1 week after you've missed your period to get the most accurate results. While some tests claim to give you accurate results before a missed period, taking a test too soon can result in a false negative. The test says you aren't pregnant, but you are. When should I call my doctor about a new pregnancy? If you've missed your period and gotten a positive pregnancy test, your next step will be to call your healthcare provider for your first appointment. If you're planning a pregnancy, a preconception appointment with your healthcare provider is a good place to start. A preconception appointment is especially important if you take medication for a chronic illness or have other medical conditions like diabetes, high blood pressure, or lupus. During this appointment, your provider will discuss any current medical conditions as well as your general health before pregnancy. This appointment is meant to get you into the best place for a new pregnancy.